Vaccines are really important to help prevent infections from the flu, COVID-19, and for those that are eligible for RSV. So it may not 100% guarantee that you may not get this illness. It helps prevent against serious infections and complications. Every year, we need to get a new flu shot because the medical community and scientists look at the pattern of which strains of influenza are really causing havoc that year. And we recommend everyone by end of September, October to start coming in and getting those flu shots. The high-dose flu vaccine is for those people who are above age 65. And the reason it's important to get the high dose is that as you get older, your immune system is unable to mount the antibody response it needs to fight against these infections. For COVID-19 vaccines, if you're eligible, when was the last shot that you got, and if you should get one now, if you just recently had COVID, do you need to get a shot right away? These are questions that you should be talking to your provider, but it's important to make sure that you're up to date to protect yourself against COVID-19 because the strain of the virus keeps on changing. So we want to make sure that you have every possible prevention method out there, and a vaccine is the best place to start. RSV stands for respiratory syncytial virus, either 8 months and younger or 8 to 19 months old with high-risk conditions. There is a new passive immunity available that you should talk to your pediatrician if your baby or infant, toddler qualifies for. For elderly adults above age 60, if you have a chronic condition or you're at high risk due to your immune system, you should talk to also your healthcare provider and see if you're eligible for a vaccine against RSV. Pneumococcal vaccine is a vaccine that protects against bacterial pneumonia. And bacterial pneumonia is one of those complications that you can get with any respiratory viral infection. Those that are under age 5, it's part of their standard immunization schedule. Adults of ages 65 and older, talk to your healthcare provider to make sure you're up to date. And if you're a high-risk individual with chronic diseases, such as chronic lung disease, check with your doctor to make sure that you're up to date with your pneumococcal vaccine. To help learn more about these vaccines and to understand better if you're eligible, you can read about it on sources such as FDA, the CDC, but it's really important to talk to your provider. Ask those questions and make sure you're getting all the prevention treatments out there.